Yeah. So this is a great question to kind of wrap up this evening. Did you start out focused on becoming an osteopathic physician versus allopathic? And how has that and the other whole person training influenced your trajectory?
All right, this is again like I don't want to disappoint any of my professors, but I never really looked at it like I'm a DO instead of an MD. I entered medical school going to the DO program, that was 25 minutes away from home, that had trained several people in my community, including my own
Mhm.
family physician. Um, and I didn't necessarily look at myself as a different kind of physician. I looked at myself as, I'm a doctor and I'm, in medical school to become a doctor. And then I was, you know, a medical student trying to become a surgeon. And then I was a surgeon just trying to be a good surgeon. And then I was a surgeon trying to focus on being an endocrine surgeon. So I didn't really look at it as I'm an osteopathic physician focusing on osteopathic principles or focusing on manual medicine. I mean, these are things I learned along the way, and I, try to embrace as much of the teachings, that were in front of me at the time. Um, but I think I would say from my perspective, there's not as much wiggle room in my mind as some people make it out to be. I don't see it as like, oh, I'm going to treat someone completely different because I'm a DO versus
Mhm.
an MD. Like if I was an MD, I was going to give them a pill, but since I'm a DO, I'm going to treat their whole person and I'm going to do something very different. I still look at medicine as relatively black and white. Like there's right answers and wrong answers, and there's a lot of gray area in between. Um, but I have a lot of friends who are DOs and a lot of friends who are MDs, and they call me about difficult patients, and I call them about difficult patients, and we don't go through things in a DO kind of way or an MD kind of way. We talk about a patient who has thyroid cancer and how we're going to safely take the thyroid out and what we're going to do afterwards. And honestly, if we were talking about a heart attack or a stroke or high blood pressure, it would be the same thing. We're just talking about, who's this patient, what's going on with them, how do we best treat them. And yes, we are thinking about the whole patient. We're thinking about whether or not they can afford the medicine, whether or not they're in prison, whether or not they're recently divorced or someone died in their family, and that is a consideration. And I think that was focused on um, in my DO program. But I also have friends who are MDs, and I know that their schools also have taken an increasingly focused approach on those other aspects of a patient's life that
Mhm.
can be contributing, to their overall health picture. So, I am a proud DO, but I will also say that being a DO doesn't really influence the way I treat patients, at least not knowingly. Maybe there's some subtle things, but for the most part, I think, uh, you know, MDs and DOs are pretty similar.
So I like to end.
If you enjoyed this, click the thumbnail to watch the full video or visit Student Doctor Network to see the free resources we have available to help you become a doctor.